Okay, so we have Gerald here today. And Gerald, do you want to talk a little bit about that right shoulder? You had a little boo-boo on that right side.
A couple weeks ago, I had to have arthroscopic surgery for torn rotator cuff. The supraspinatus was torn from the humerus, and they had to reattach my bicep tendon. It's pretty extensive surgery.
It had a lot of arthritic spurring too that they had to clean up on it.
Yeah, there were spurs and that was what was doing the damage to my tendons, and they cleaned all that up, and it's about a year-long rehabilitation.
So the soft tissues are what the soft tissues, the muscles, the ligaments, and tendons. That's what moves the joint. And so when we have a lack of or abnormal movement of the joint, then we have this spurring formation occurring. So what you had on that right shoulder was just the effects of a long-term tendon soft tissue problem that we've already seen years ago on this thing.
Yeah, I think that originally when I had a problem with this shoulder, I didn't know about you back then, and I just went straight to surgery, and I believe the surgery was, it helped some, but it was not a complete success. And then over the years, I just it was I eventually just re-damaged the shoulder over a long period of years.
Right. So the purpose in you being here this time is we have a little problem on the left shoulder, and you don't want to do the same thing to the left shoulder as happened to the right. And so that's why we're here working on Gerald's left shoulder. So we do have a rotator cuff tear on the left side, and significantly less pain than what you had on the right side. But you didn't want to get there, so that's why we're working on the left side.
Years ago when I first injured this arm, it wasn't that bad either.
Right.
Yeah, now that I've been relying a lot more on my left arm, and I think I've obviously injured it, and I thought, while I'm getting this one fixed, I probably better do something to prevent this one from getting any worse, and repairing this one, so I don't have to to go this route on this side.
Right. So let's go back to the first day that we treated you. We've had a number of treatments completed on you now, but back to the first treatment on this shoulder. How much improvement did you note after that first treatment, percentage-wise?
Well, when I first came in, I had, he tested my muscles, and they were just all weak. I had no strength at all in any of the tests. So it's like just going from, and then after just a brief treatment,
Couple of minutes at the most.
Yeah. I had strength in all the tests.
So percentage-wise, how much better was it? Would you say in the strength when we got
like 30%, maybe.
30%.
Maybe even 100%, because going from nothing to full strength is, that's like almost like, night and day.
Right. And so, where would you put yourself now as far as percentage of improvement overall?
Well, although the reason why I came here is because you actually fixed this arm before, and so I knew that it works. I'm sorry, what was the question?
Percentage-wise, how much better are you overall?
We've had a few treatments now, and I'm actually surprised at how well my shoulder is responding this time.
So give me a number, percentage-wise. What would you say? How much would you say? I
would say we're probably 70%
okay,
there.
Good. So the whole idea then again is to remove the scar tissue off the torn tendon, and once we do that, then the good collagen fiber will fill back in, so we can actually restore the shoulder back to normal function without the surgical repair. So there is definitely an option for people who have a rotator cuff tear versus surgery. It's just we want to catch this one before you have to do surgery like you did on the other one. So, Gerald, thank you. See you later.
Did you want to talk about? I plan on getting the work done on this.
Oh well, yeah. Absolutely. We can put a couple plugs in on that. Once he gets done with the rehab on the right shoulder with the physical therapy, then we're going to go back and try to get as much scar tissue out of there as we can, so we can gain as much motion and decrease the pain to the best we can. So there is even with surgical repair, there are things that we can do to help improve the function, improve and decrease the pain. And so that's our goal on the right side.
And how many weeks after the original surgery would you be able to start doing that on this arm?
Probably 8 to 10 weeks. I mean, once they release you from physical therapy, then we probably take over from there.
Okay.
So, we got it.